work.
Right?
Okay.
Are we live? No, not yet.
There are 2 people here already. Huh.
Where? So desu ne, so desu ka.
Hello, so I think we're live. Oh wait,
Hi.
no one's here yet. So,
Are we live?
yes, we're live.
Okay, well, hi everyone. If you see us, say hello. Say hello and where you are, because we'd like to know. And also, so we're sure that we're live.
Yeah.
um, Gavin's joining just for a little bit today.
Yeah,
This is
cuz
not working.
they changed hmm? They changed my
They changed his class schedule
only today.
only today.
Yeah, unfortunately.
But you can be here a little bit with us, right?
I can.
Good. So we're going to
Till
wait a few
10:05.
minutes and wait for some more people to come in.
Hello.
Hi! Oh, Jana's here. Yay! Hi!
Yay!
I know it's evening for her, so we can say good evening.
Good evening.
You know, it's been super snowy. Like in New York, at least, for sure. So many of our friends have just been dealing with a lot of snow and stuff.
I want to be there right now.
You want to be there right
Yeah,
now?
it's colder.
It is colder, but it's been quite pleasant. Hi, Joanne.
Hello.
Good morning. So we have good morning and good evening.
Good morning and good evening.
So yeah, we'll wait just a
And
few
good
more minutes.
evening.
And good evening. It's going to be an interesting topic today.
Yes.
Do you remember our topic today?
Yes, I do.
What is it? My face?
No. What is it again? I forgot. Our skin sites on skin issues from sex and close contact.
From sex and close contact. Because it's not always from sex. You can actually get, it's so interesting. I was looking this up and my mom was studying it because she knows everything, but she still studies for this, just like with any lecture or whatever.
Yeah.
And so, so I learned a new thing, Connubial.
Connubial.
Connubial and consent dermatitis. Consort, not consent. Connubial and consort dermatitis.
New silic microscopic something. I'm trying to memorize that word. That's the longest word in the English alphabet, no dictionary.
There you go. But yeah, it'll be an interesting discussion today.
Oh, and can you hear us? Because it's a bit farther today, the mic.
Our mic is a little bit further from us today.
Yeah. Also, are we having any problems with audio and video syncing?
I know, isn't that interesting? We've had problems the last 2 times with a little bit of a delay. So
Yeah, but hopefully not now.
hopefully not today. Hopefully we shall be okay.
Yeah. Comment.
What do you want to comment?
Hello.
Then you're going to comment as VMV. There's Nina. She says they can hear us really clear.
Hello.
Gavin's typing a message. Okay.
It's literally just hello.
So yeah, say hello wherever you are. We'd certainly love to know who's watching, where you are. I know we have some people sometimes from Nepal. At one point we had from Costa Rica. Russia is rare because of the time difference.
Yeah.
And the US. So definitely let us know where you are. Also in part because it helps us cater a little bit what we're talking about. Because if it's really, really cold where you are, that might affect some of the skin
that might
sites.
affect some of the infections or stuff.
Yes, how your skin behaves.
Yeah.
Your skin changes its behavior in the cold and the heat.
Yeah.
Game, do you want to start? Or should we wait just a little more, like 10:05?
10:05.
That
Which
sound good to you?
is in 10 seconds. Yep. 10:04.
He's fully recovered, as you can see. He was feeling
am.
quite ill a few weeks ago. Oh, there we go.
Like 3, actually.
Thank you guys for the feedback on the audio. Jelly from Manila, hello. And Sam.
Hello. Hello.
Hi, everybody. We did our workout this morning.
Yes,
We're very
we did.
good. We did our boot camp, HIIT, this morning, the whole family,
Yes,
and then
we did.
meditation.
Well, not the whole thing.
And I'm all gussied up for Chinese New Year, which is in a few days.
Yes. So shall we start?
Let's start. Game. You want to say? Gong Hei Fat Choi.
Gang Hei Fat Choi.
Chinese New Year is in 2 days. So I figured, round things and red to be celebratory. Other things?
My
he's in
school
green.
has another event, so I'm
So
wearing all green because it's my house color.
exactly. And it's also Black History Month, so that's
It
pretty
is.
cool. And it's Valentine's on Sunday. Happy
Yes.
VM Valentine's, as we like to
Happy
say.
VM
Yes.
Valentine's.
So, rather fittingly, since it is Valentine's on Sunday, welcome to our skin sites on skin issues from sex and other close contact, because it isn't always sex, believe it or not. It can be from other things. Do you know that song, the Salt and Pepper song? Let's talk about sex, baby. Let's talk about. You don't know that song?
I've never
I've
heard
been
it.
remiss in my musical education. You know Salt and Pepper, though.
I do know Salt and Pepper.
Do you know a song of Salt and Pepper? Can you name one? What a man, what a mighty good.
Oh, really?
That's
Oh.
okay. Anyway, so what we're going to get into is skin issues that can be from sexual contact, but also even just from close contact. And I think it'll be a really interesting take home for a lot of people that you can actually get problems on the skin, even on the genitals, without having it being a sexual thing.
Yeah. I need to go now.
Okay, why don't you do that quickly though?
Oh yeah. Please remember to well, we're on Facebook, so please follow us on Facebook at VMV Hypoallergenics.
Subscribe.
In our YouTube channel, which is also VMV Hypoallergenics. Also, well, yeah. Have a good day.
Follow us on Instagram.
Follow us on Instagram.
Thank you, Gavin. My co-host is leaving. I am alone. Remember to ask your questions early so we make sure we get them answered. Sometimes the questions come rapidly at the end, and then, I'm rapid fire trying to get them all, but we are going to try to get them all. And if they're VMV related questions, definitely try to get them earlier, because when my mom is on, we really focus on the skin stuff. And please don't forget to comment if there's other stuff you want us to cover here or in our other videos on YouTube. So getting into the topic today, I will preface this by saying, in our family, as you can see, we talk about sex and health rather openly and frankly, responsibly, of course, and in a medical context, right? But if that's something that you're not comfortable with, either yourself or with your family or with your kids, that's something you should know. Today's topic will cover sexually transmitted diseases, sexually transmitted infections, non-sexual contact that can spread, skin concerns. So use your judgment, go by your beliefs and your comfort level, but everything will be discussed here very properly, or very safely, I should say, without judgment and in a medical context. So because it's such a medical thing, I actually will not be delving into it too much, but I will say a few key things that, if nothing else, I hope you take home today. One is, please do not ever be embarrassed about seeking medical advice for a skin problem in the genitals or on the genitals. That's what dermatologists are for, and believe me when I say they have seen it all. They've seen it all. There's nothing that you can do to make them uncomfortable or make them blush. Second is that virgin coconut oil is safe to use in the genitals, even for babies, for cleaning up meconium, even for newborns. But as with all oils, do not use virgin coconut oil as a lubricant with latex condoms. Oils degrade latex. And the last thing I wanted to share is, not all skin problems on the genitalia are from sexual activity. Molluscum Contagiosum is a viral thing that can actually be spread. It's fairly common in children, and it can be spread through fomites, sheets, bed sheets, towels, and things like that. Sorry, one more thing. You can be allergic. I thought this was very cute. You can be allergic to your partner or your kids even, in a way. It's called Connubial or Consort Dermatitis, which we'll get into. And it's basically when, let's say, your partner is using a soap or a lotion or a cream that you happen to be allergic to. So they're not allergic to it at all, but you are. When you come into close contact, you can actually react. So this can even happen between moms and babies because so many baby products are loaded with fragrance, for example. If you happen to be allergic to fragrance, holding baby can actually be a problem for you, or vice versa. If baby is allergic to fragrance and you happen to use a lot of fragrance in your shampoo, in your body wash, in your body lotion, baby can react from that. So it's therefore not such a stretch to say that when you choose our allergen free products, it's an act of love. Not just self love, but also for the people around you that you cuddle with, that you come in contact with. Um, so using VMV, yeah. And you can shop all of our stuff. Oh, I got distracted a little bit because I wanted to make sure I got that in. I'll mention it later. You can shop all of our products at vmvhypoallergenics.com in the US and around the world, and vmvhypoallergenics.ph in the Philippines. Most of our products contain our organic, clinically published virgin coconut oil and monolaurin, which has so many great benefits. In the USA right now, when you shop Avery Everything Eye Serum, you get another as a free gift, which is nice, and it's also a cute couples thing. Also, we're giving away for qualified purchase the full regimen. This is missing the Super Skin Toner, but it's the starter regimen for Moisture Rich, which is great, I think, to start out the year with to make sure your regimen is on point. And if you go to the glowing gone section of our website, we have a bunch of faves, product faves, that are on 50% off because the sell by date is coming up. Our products don't really expire. There's a wonderful article on vmvinskin.com about expiration in cosmetics and what that really means. But check that out on vmvhypoallergenics.com. And we're also offering route packaging. So you have insurance now, very affordable for lost or stolen packages. And in the Philippines, we have, which I think is awesome for Valentine's Day. If you shop one, you get a free lipstick or lip gloss as your free gift. You can also get a free lipstick at our boutiques in the Philippines when you shop. And then, this is awesome. It's a Stay Safe skin bundle from VMV Skin Research Center and Clinic that comes with the monolaurin pellets and a full-size Know-It Oil, virgin coconut oil, and not one but two, of course they're facing backwards, two, two superwash bottles. And it's really cool. It's discounted from like 2,000 something bucks to 800 something. So it's a very wonderful way to stay safe in the pandemic. And don't forget, anywhere that you are, if you would like a teleconsultation with my mother or any of the doctors or nutritionists that we work with, drop us a PM. If you've had a patch test and are struggling to find products that you can use, we can customize recommendations for you based on your patch test and possible cross reactions. And the last thing I'll mention before I call in my mom is I ran into, when I was researching this topic for what's new, I ran into a paper, she has newer stuff from 2019, but I ran into a paper from 2013 published in the Journal of Cutaneous and Ocular Toxicology. And it's entitled, if you want to look for it, Exuberant, which I thought was funny, Exuberant Connubial Allergic Contact Dermatitis from diphenhydramine, right? And this is from the abstract. It says connubial or consort allergic contact dermatitis occurs when the agent causing the dermatitis has not been used by the patient, but by their partner or other cohabitants or proxy. Most cases are due to fragrances, cosmetics, or topical non-steroidal anti-inflammatory agents. In this report, they talk about connubial dermatitis caused by topical diphenhydramine, which is a topical antihistamine. And I thought it was super interesting because there are so many, there's a surprising amount of products, either from steroids to antibiotics to antihistamines, that are meant to help precisely with skin reactions, itching or insect bites or rashes that are actually allergens. And so in this particular case, a wife applied the diphenhydramine on her husband's back and she reacted. So I thought that was a really interesting case. In other words, keeping reactions at bay is a group effort. And to help us with that group effort, I'm going to welcome my mom, Dr. Vermen Verallo-Rowell, who's also our founding dermatopathologist. Come on in, Mom. Join us. Don't you look lovely?
Thank you.
Hi. Mwah. Sit.
So-
Gavin, there. You're supposed to sit there. There you go.
to
comfortable?
celebratory occasions, I thought I'd wear something. Happy Chinese New Year.
Exactly. Same here. Great
And
minds.
Happy Valentine.
Exactly. And Black History Month.
Yes.
So, Dr. Vermen Verallo-Rowell is a clinician who has seen it all.
Can I just go get my glasses?
Sure, while I'm
I'll be right
introducing
back.
her. But she has seen it all. Like, I remember some of the cases that she's had to deal with, in reports and stuff like that. Really impressive things all over the body, including the genitalia. And she deals with everything from aesthetics to acne to superbugs that we're seeing now, like Klebsiella on the chin, causing acne. Really quite stunning. To pemphigus vulgaris in hospitalized cases, to anything that you can imagine on the genitals and between partners from non-sexual close contact. In addition to being a clinician, she's a dermatopathologist, so she's the one that reads biopsies, which really helps in the diagnosis and treatment of infections in particular. So, and she's multi-published all over the place, especially on contact dermatitis, so say hi.
Hi.
Okay, so to get us started, I wanted to ask you, what are some of the more common sexually transmitted infections or diseases that manifest as skin problems
Oh,
in the genitalia in particular?
yes, right. I was looking forward so much to this session because, to start with, contact dermatitis cases are very often misdiagnosed. And I'm talking about just ordinary contact dermatitis, either from the perfume or from the laundry soap or from, the earrings, things like that. Very often they are misdiagnosed. And they go on sometimes for years being treated as acne, like she was talking about, as acne or some other weird diseases or well. And then it turns out it's just contact dermatitis. Or it might even be a disease that is like psoriasis that refuses to go away completely, even with these beautiful new targeted biologics, because there's a secondary contact
Issue.
dermatitis. So it can be primary or secondary, and very often, like I said, missed in diagnosis. Well,
So, yeah.
the genital lesions, or not just genital, but lesions that one gets from a wife or a husband, connubial,
Doesn't have to be a
or
wife or husband. It can be
or a
any
partner,
sexual
and
partner.
that becomes cohort, or can it be to somebody who hugs you tight like your kids? They can be there. So let's start with the most common ones. Most common ones
That are sexually transmitted,
that
that are not contact dermatitis. So this is really sexually
transmitted.
transmitted.
Okay. That are sexually transmitted can be from the semen, actually. There have been very rare, but
That's contact dermatitis, though.
no.
That's also
Yeah, it is also contact
right.
dermatitis.
So backing up, so the common ones would be what, like syphilis.
Oh,
Syphilis
you
has
mean the
skin
infectious diseases?
I mean, actually, sexually transmitted diseases
Okay, I
that
get it.
manifest on the skin.
All right, there are
Right.
quite a few.
Yeah.
Starting from the very simple, you can have, lice, crab.
Crabs.
Okay, so
What are crabs? They are a lice.
they're lice. There are some kind of lice that likes to go down there and lives in the hairs there,
In the
so that
pubis.
with close contact, they can go from one partner to another.
Right.
Then you
So-
have another one
And they're
that's
itchy.
very. And then there's another one called Molluscum Contagiosum, which, by the way, can occur in children.
And doesn't have to be sexually transmitted. This
that's
is
not-
both
yeah.
sexual or not.
In children, it's because it is a common virus, and when they play around with other kids who also have the molluscum, they get it from each other, and so they reinfect. And it's their very first time to meet the virus, and so they get the infection, and then it disappears with treatment or without treatment, usually in a couple of years. With treatment, you
And
can burn
looks
it or
like,
whatever.
It looks like little dots.
Like little dots, but with a little tiny hole in the middle, what we call an impression down there that you
So,
can see, and you
yeah.
can actually express the molluscoid body out of it. Ugh.
But the reason I mention this actually is because several live streams back, we were saying why it's such not a good idea to self-diagnose, even something that you think is so basic like acne. Because many things in dermatology, especially in dermatology, Arguably more than in any other field, any other specialty, so many things are confused for one or the other. Something like Molluscum Contagiosum truly can be mistaken for
Yes.
keratosis pilaris.
Right, which is not at all
Which is not-
infectious.
yeah, or sweat
Actinic
acne.
keratosis,
So
which
many
is a
things,
sun-induced
right?
keratosis.
Yeah.
It's not infectious.
And if you're self-diagnosing, you might be seeing this and thinking, it's just sweat acne.
Right.
It may not be, right?
Yeah.
So it really is important to kind of get your doctor's input on that.
Right.
So,
the another one would be
yeah.
herpes. A very common thing. You can have it because your partner, if you do orogenital sex, for instance, orogenital sex, with your partner having herpes in the lips or in the mouth, they may transmit that, and so you get herpes type 1, which is normally in the oropharyngeal
Yeah.
area, type 1 over there, which is, and you get also little bubbles down there.
So this is interesting to me because not all herpes I think has gotten a bit of a bad rap in that when you hear herpes, you immediately think sexually transmitted. It's not necessarily. You can have a fever that's herpetic. It's just a virus, right? But it can then become a sexual thing when, as she mentioned, if you have a partner who has, let's say, a sore in the mouth or something, or bubbles in the mouth, and they happen to be herpetic, not from sex, they just happen to be, right? And if they then have orogenital sex with you, then you could have it in the genital area, right? So now it's a sexual thing. But herpes to me is interesting because everyone just thinks you get it from sex.
So
Not
yeast
necessarily.
infection is common down there in women in particular.
That's not always from sex, though.
That's not always from sex.
That can be from underwear.
That's right.
Really.
Or taking antibiotics too much, so
That's
that you,
right,
you
and
change
not-
the microbiota in
Not
the
eating your yogurt and your kimchi and your probiotics when you're on antibiotics. Other things, I know syphilis can sometimes manifest on the skin.
It can actually begin there with a little bit of an ulcer in the penis or in the woman's vulva as well. So it can start there, and in cases like that, um, here in in the Philippines, we do have government institutions that people who are into the business can go to and regularly have themselves examined. It's young ladies with naughty habits who.
Not naughty. I don't want to be judgy. Whatever.
Okay,
Anyone who
whatever.
has sex.
Okay,
Yeah.
who have sex with other people who are not checked on themselves, and you could actually get an infection. So just be careful and check
Use a
yourself out.
condom,
If you develop
get
any lesion
tested.
down there anyway, have it checked.
Yeah, for
Okay.
sure. Don't dismiss it.
Right.
Gonorrhea, does that have any manifestations on the skin?
Gonorrhea, not so much as a discharge
Okay.
that'll be coming out that is different from trichomonas, just a different kind of a smell and all. So these have discharges that are coming out from your
Genital area.
from your genital area, and needs to be examined in order to
Yeah.
make the proper diagnosis whether it's GC or trichomonas or something else.
What about HPV? Or what is the other one? Chlamydia. Chlamydia is the most common one. isn't it?
Chlamydia is also quite common, and HPV is also quite common, and these are things that
Are there
And-
skin lesions associated? Like, would you notice them in skin? Like, would there be warning signs?
a
in the
little bit
skin?
of an erosion, a little bit of a dermatitis, but nothing very specific.
Okay.
So,
So that's why you really can't self-diagnose these things, right? You want to be seeing your gynecologist, you want to be seeing your dermatologist just to make sure you get a proper diagnosis. Now, on to what I think is actually a little more interesting here is, are there non-sexual conditions that can still show as skin problems in the genitalia? And I think this is what you were talking
I got
about
started
earlier.
earlier. Very rare, but it happens that a person is allergic to the semen of her husband. And there's a report on that. Like I said, it's very unusual, but it does occur. This woman was very allergic to it. She developed something like a contact urticaria is what we call it, so that she would develop cramps in the stomach after sex and genital itching as well as, and at one time apparently she was brought to the ER because she went into some kind of a
And that
collapse.
would be a type 1 reaction
And
because
that's
of the urticaria. or no? That would still be contact
Contact
dermatitis.
urticaria. So it could be a type 1, it could be a bridge between type 1 and type 2, a type 4. And because when the husband would wear a condom, the lady didn't have any problem. And talking about condoms, there's another source for
Skin problems.
skin problem
Morning, Edna.
that you
Morning,
may get
Jackie.
from your husband. Your husband can get it from your diaphragm, which has some latex in it, and you
Latex is a common contact allergen, is the thing.
can right,
Yeah. So that
and
could
you
be
can
an
get it
issue.
from him if he's using latex. Condom made of latex, which is the more common variety. There are others which are not, and you can use them as long as they're not using any material that you're allergic to as well. So
Yeah, flavors, fragrances,
yeah,
dyes.
right,
These things are common contact allergens. So when choosing a condom, if you happen to have a latex allergy,
correct.
you or your partner happens to have a latex allergy, might want to avoid the latex condoms,
Yes.
get other ones, and then avoid the other allergens if you can as well.
Yes,
Right?
right.
One thing there that you actually just made me think of right now, menstrual cups.
Yes, the menstrual cups are made of plastic, though.
Yeah.
I think.
If they have rubberized
Yes,
plastic
right.
or latex, you might want to. Again, this all depends on what your patch tests show. If you're not allergic to rubber or latex, then use whatever you want, right? But do be guided by your patch test. If your patch test shows you were allergic to rubbers and latex, even when choosing your menstrual cup, this is something to think about.
Right.
When choosing your sanitary pads and your
Yes.
tampons,
Right.
if you're allergic to bleaches, fragrance. Oh my God, the biggest thing. We always have to find fragrance-free things. It can really be a problem,
Correct.
for women who are on their period.
And lots of ladies also like to use the sprays down there to clean themselves, to wash themselves
Yeah.
with something really nice smelling,
It's not-
Well,
yeah.
they can be allergenic. And so there are, again, lots of reports in the literature about men rather, who develop rashes from exposure of their genitals, so they can have a balanoposthitis or the balanitis, which is the inflammation of the head of the penis, or including also the shaft as well as the scrotal skin area because of exposure.
This is fascinating to me because women, there's so much marketing to women that somehow we have a
Correct.
problem in our genital area and men don't. We don't. Okay, so whatever is in our natural sort of vaginal microbiome, that is healthy, it is meant to be. That is not wrong. It's not something to be corrected. And you're not supposed to smell like lavender in spring in a field in Paris. You're just not supposed to. So when we're talking even about vaginal washes, be very careful that there are no antimicrobials that can upset that balance. Be very careful. There's not a lot of preservatives and dyes and fragrance that can really cause problems with you, but also, as we're hearing today, with your partner.
That's right.
If they happen to be allergic to fragrances and all this stuff, you could actually be causing a reaction in them, not just for you.
Right.
So it's really just mild wash.
Or you
is
may not be
fine.
allergic to it.
Yeah,
So
that's
that's
true.
why
You
you're
might not be
using
at
it.
all. Yeah.
Instead, it's your
Your
partner,
partner.
who's allergic to perfume or
Right.
propylene glycol or the preservative or,
Yeah.
the colorant, whatever.
Leave
So-
well enough alone, really and truly. There's nothing that needs to be fixed down there. If there's an unusual discharge or an unusual smell, then go see your gynecologist
Right.
or your dermatologist. But otherwise, there is nothing to fix. There's nothing to correct. We're lovely, lovely creatures, women. There. So what else? What you were talking about, connubial and consort contact dermatitis. I
Right.
want to know more about this. This is
Right.
fascinating to
Okay,
me.
so
Because
what-
it's not just sexual.
So far, we've been talking about the sex part of it and the genitals and the penis, but you can have, interestingly, a man whose wife would lie down on his left side, right? But she had a hair dye. Had dyed her hair, and so he developed a rash here on the front of the axilla, as well as on the chin area. So just those areas. You can see how if that guy were to come to the dermatologist, for instance, it's kind of difficult to say, did you lie down with your wife and she was
Or partner.
or partner and she was,
Or they were.
they were okay, they were positioned that way. It has to be an astute, or your dermatologist has to go beyond and asking various things. That's what I normally do when I ask. I had a patient the other day. Boy was brought to me because he had a rash that was just on the left eye, the left cheek, and the left outer arm.
Oh, interesting.
You know, so, uh, but it was not presented that way. You see, the father came to me and said, "My child, he got his face. There's something wrong with his face. He's got a rash here and all that." So, what I always do is take pictures, because when the child moves or when the person moves, it's very difficult to really take a good look at them. I take a position and I take a good frontal, side view, three-fourths, whatever view. And as we look at it, we realize it was really just the left eye here, and towards the inner part there wasn't any. It was more here and this one. And then the ear also was a little bit here and that one. And because we now have a picture, it's not the face, it's just the left side of the face. The right side was pretty okay. There was nothing in there, nothing there. So this is what I mean by anatomically, somebody has to take a really good look at you and just say,
Yeah.
you got a rash on your face. Oh, okay, try this kind of medication or
Steroids
whatever. Right?
immediately, right?
Right. It turned out that, so I said, can you bring me to where do you normally sit when you're in front of your computer? Because the dad said about 12 hours of computer use. I said, okay, but it's so left-sided, and with a computer it would be frontal, and it would be much more there. This looks a little bit stronger. Do you have a window? No, 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 our shades are all closed. So little boy brings me to his bedroom. Apparently he has it in his bedroom. Wow. Okay, and in front of him is this beautiful window that is blinds are closed. But over to the left side is a smaller window, blinds all the way up, bright as anything, shining into his left side of the face. So there's the culprit,
There you go.
right? So yeah,
Yeah, when dealing, so okay, I guess one of the things to learn here is, again, number one, not all skin issues from partners are from sex. It really could be from other things. We heard from Molluscum Contagiosum earlier today. It's not even just sexually transmitted. You can get it from towels, bed sheets, fomites, right?
Right.
So that's one, I think, key thing to remember here. The other key thing to remember here is really dermatologists, especially contact dermatitis specialists, can be such investigators. They're really rather wonderful to watch work because they're such detectives. If you see a rash, like she said, the first thing they're going to do is figure out. So sorry, but this is what I think someone would tend to self-diagnose, right? Or people who aren't particularly trained in contact dermatitis. They see something on your face, immediately reach for a steroid, or immediately, oh, you're allergic to that, throw it away, right? They won't necessarily do what contact dermatitis specialists will do, which will, like she did, where is it? If it's really just on this side of the face, honestly, it's quite unlikely it's because of a cream. Because you wouldn't be applying a cream just here. You'd probably apply it all over, right?
And yet your reaction is only on that
It's
side.
so clearly here. So then you start digging. What might it be? And eventually here it turned out to be light on the left side. If it's not that though, it could actually be how you sleep on your pillow. It could be your pillow,
That's right.
laundry detergent, etc. Or it could be your partner. If you tend to sort of lean on your partner, and what are they using as a cream?
Exactly.
Right?
Yeah, that's very
That's
common.
where it gets so interesting to me, is that your partner isn't allergic to that cream. They love it, or that shaving cream, or that cologne, or whatever, but you happen to be. So when you lean against them, you're the one that gets the reaction, not them.
And remember, perfumes are made of oils. There is a little bit of oil or scent or whatever there. And that doesn't completely get washed off when they shower or wash their faces. Part of that oil is organic, and therefore it will stay put in the skin. And if you're allergic to that, you can then get a reaction to it as well, if you're the one who are allergic to it. He's not, again, but you get it. So this is another form of consort dermatitis. Regarding laundry soap, by the way, this is a very common allergen nowadays, because of the many chemicals that have to go into it, including the one that makes it bubble, as well as the ones that preserve it, the ones that make it smell nice, and the chlorine to bleach it. So there are lots of ingredients in it.
Yeah.
And
That can affect, especially in the underwear
yeah,
area.
oh, underwear area, you have to really look and see why just there, you know? Why is it in that particular area?
And that applies to
Right,
darkening too, not
right.
just rashes or not like pimple type eruptions. It can
Yeah,
be the darkening under the bra,
right,
where you wear your underwear for men, sort of around
right.
boxers or briefs or whatever. You should
Look at
look at that.
yourself
Yeah.
in the mirror when you have no clothes
With
on
love.
with love,
With
right?
love.
Because show this often to people, especially those with some kind of brown skin, light to dark, you know. When I begin to suspect they have a greater amount of allergy, that is what they're showing me. I'll say, can you take off your shirt? Let me see your back. And then I look at this beautiful woman who's got very nice looking skin on the outside, like this one is flawless and all that. That's relatively okay. And then their back is, discolored like that. Waistline, let me see your waistband area. It's discolored, the navel. And then, do you mind? Can we take a look at how the skin in the abdomen, in the genital, in the men, the scrotal skin is a very good giveaway of what they are using in their laundry soap that they may be sensitive to, because it can be dry, thickened, pigmented, and then I ask them
Yeah.
also to show their back. Boy, this is such an amazing thing. And when they go in, you look at the buttocks as well as the curve. It's hyperpigmented because that's the area where the elastic, the rubber, the whatever of their briefs could be in touch with. These are all contact dermatitis, but we call them pigmented contact derm because
Yeah.
unlike the usual contact dermatitis, where there's usually an itch, then a little bit of a bubble and an eczematous kind of a thing, and it's itchy like mad. Pigmented contact dermatitis is a very chronic type of
It's
contact
gradual
dermatitis,
almost, huh?
gradual,
Yeah.
and it just becomes discolored,
Yeah.
really dark.
So people just dismiss it as aging because it's not
Right,
necessarily preceded by
right,
itching or
correct.
redness. It just darkens over time. So
Yeah.
that's something to look at. I have a nice question. Thank you so much, Jenny. Good morning. Just a question. I love this question because I'm going to tag onto it. Is it possible to get a bacterial infestation? You become a carrier of the bacteria from sexual contact with someone.
Yes, it can be. You could become a carrier for the bacteria, which is not normally a bad one, but has become in this day and age a mercy. I was just talking
I was
to
going to say
at another
MRSA,
meeting
yeah.
I was at. I said to the infectious disease doctor, guess what? I have a patient with supposed pimples only,
This is
but I
incredible,
did a
yeah.
culture because they were not responding to the usual acne treatments given by others and my initial treatment. And when I did that and it didn't, I said, okay, so this is really
We need a
beyond.
culture.
We did a culture and it turned out to be mercy, not MRSA, mercy, methicillin resistant Staphylococcus epidermidis. And epidermidis is, yeah, it's not a bad bug
Yeah.
basically
It's
there. It
almost,
lives there.
what is the
You know.
big deal,
Yeah,
right?
what's the big deal with an
Mercy,
epidermidis?
yeah.
But in this case, it was resistant to oxacillin and many of the other common antibiotics used for it. So we had to use a different antibiotic that it was sensitive to. You could, in fact, be carrying that without any pimples, without any lesions. And if you
Transfer.
are now, if your consort, if your partner happens to have his immunity down
Or
because
her.
of stress times, because of COVID times, because of worry about this and that and the business and whatever, it's amazing. Almost everybody I ask, how stressed nowadays? I know your stress level is about 7 over 10 anyway. How's the stress level now? Many of them will say, oh, it's about the same, doctora. Nothing worse. It's still about the same. When I discover a skin change that is not at all ordinary, in other words, it signals the fact that their immune status has gone down and they're getting an
Right. Because
infection,
chronic
they're
stress is no
losing
joke. That
hair,
can really affect, yeah.
they're shedding hairs, whatever.
Yeah.
I often tell them, remember, your skin is a better judge of stress, it seems. It's already complaining about the stress and you still think you're okay. Better address it. Better face it squarely
Yeah.
and accept that there is a little bit more
So
stress.
point
and you need
being, yes, if you have, you can be carrying a bacteria that actually isn't a problem
Okay.
per se, but when you are in close contact with someone
whose immunity is down.
whose immunity has been reduced because of stress or because of anything else, because maybe they're on drugs that are immunosuppressants, maybe they're on chemotherapy or whatever, maybe they're fighting another infection already, then they all of a sudden, you're fine, but with contact with you, they all of a sudden can get it, and it's not fine for them. It can become a thing. I wanted to dovetail off of this question to really emphasize things like eczema and psoriasis are not contagious.
No.
And
No.
this is important to know because it looks sometimes
Yes.
these conditions can look really dramatically. Whoa, what's going on there? Severe peeling, severe, it looks almost necrotic sometimes, like dead. Really not contagious. Sometimes there's oozing,
Right.
right?
Right.
You won't get eczema or psoriasis by touching someone with eczema or
No.
psoriasis.
Love
So-
them, hug them, because they
Exactly.
need that. They are
If you're
looked
co-living, don't be hugging anybody now. We still need the social distancing.
Okay.
If you're co-living with someone with eczema or psoriasis, hug them and make them feel loved because it is not contagious. Yes, please.
However, let me just say that COVID times has given us difficulties though, because the usual treatment for them is the use of steroids. And nowadays we
Yeah.
are getting so many secondary infections to a non-infectious condition like atopic dermatitis, contact dermatitis, or psoriasis, or rosacea. They get secondarily infected because
There's so much.
of the steroids
Yeah.
that are used to treat them, and it thins the skin, it changes their barrier. You've heard me talk about this.
Yeah.
And so therefore,
Yeah. We have a nice live stream all about topical steroids, so get into that. I have a question for you. You had a really wonderful case recently of Klebsiella. Klebsiella is one of those superbugs like MRSA, and it was shocking to me to see it on the face, right? Again, it looked like acne. And then it looked like maybe it's a fungal acne or Demodex maskne. These are the common culprits. This was entirely new to me because
Yeah.
Klebsiella, everything I've read about Klebsiella is it's in the ICU. It's a hospital bug.
Right.
This was on the face in acne. So I'm curious if you have that on the face. I apologize, we have a helicopter passing overhead. I hope you can still hear us. Oof, they'll be gone in a few seconds.
bye-bye.
Bye. Bye. Later na. Anyway, if you have this Klebsiella infection here and you kiss somebody, could you pass that infection to them?
Again, it would depend upon the immunity of the other person.
Okay.
It's always the immunity of the person.
So assuming their immunity is good, they'd be fine. They'd be
They
able to
probably
resist
be
it.
okay, although it's
But if they have a cut or their immunity is down,
they might get it. Right. It's
So, yeah.
This is just for those of you who may or listening, who've had a skin problem that has been there for a long time.
yeah.
Recurring. This Klebsiella patient of mine started having this in 2012. And she would every now and then get them. And sometimes they would become very
And they look like
ugly
acne.
looking.
Again, this is just the kind of thing you would dismiss as
Yeah,
acne,
right.
cystic acne.
Right.
Not
but
at all.
and not just cystic acne, but very necrotic, you know?
But again, you need a specialist. I
Right.
want to make sure we
Okay,
stay on
all
topic
right.
because we have some other really nice questions.
Okay.
Ruth has a great question. Ooh, I like that too. I don't see who asked this question, but we're going to ask it. I think it's good. If you have butt acne and scars, how do we treat that?
But acne?
Buttony,
Buttocks, right?
buttocks.
Oh, okay.
Posterior,
Right.
derriere,
Right.
gluteus maximus. Yes.
Acne on the butt. Okay. It may start out from a contact dermatitis to what you're sitting on for long hours of the day. And that could be anything like the dye of what you're sitting on. Most
Or
of
your
us will
underwear.
sit on black. Let me start with
Sorry.
the outside muna.
Yes, okay, sorry.
So the black, a seat that you're sitting on, it could be from the dye, it could be from the material like leather, it could be made from the rubber material there. It could be from the cushion that's underneath. It could be from the preservatives that, most of these things are sold and shipped, and therefore they are preserved in some kind of chemicals. So it could be an allergic contact dermatitis to what's holding your haunch, okay? And if that is then treated with steroids, it's okay. But you must get rid of the cause. Because not getting rid of the cause will then give you a recurring
Yep.
dermatitis there. And then over time, that becomes secondarily infected because, like I said, because of the steroids. And over time, the secondary infection becomes scarred. Is that's the question? Butt, knee.
Yeah, butt acne. But
with,
butt acne
with
doesn't have to be a dermatitis. It can be an acne. Butt or folliculitis. Can't it be
Yes.
melassasia?
Right.
Folliculitis?
It can be folliculitis from, again, a fungus
Which
or
is-
a bacteria.
People call it sweat acne. It's
Right.
not acne.
But again, those normally occur when there is soil that is already immunocompromised, where the barrier is already destroyed. And so the fungus grows.
By soil, she means the skin.
the skin.
So we're clear.
The Malassezia fungus is a natural inhabitant of our skin.
Right. So, okay, when people talk about sweat acne, first thing is it's not really an acne, right? It's a folliculitis.
Right.
Second, it's not, so here's the thing, a lot of acnes are caused by bacteria. So when you treat acne, you tend to just grab the typical anti-acne antibiotic, right? That won't necessarily work with this because it's a fungal condition.
Correct.
So a lot of times when you have sweat acne on the chest, sweaty areas, right? Because the fungus lives naturally in our bodies. It's a happy, normal part of our bodies, and it happens to feed on sweat. When you happen to be very sweaty, like yours truly, so chest, backs of the thighs, the butt area, yeah, they can go a little over happy, and go a little nuts. So then you need sort of a fungal thing there.
That's right.
To deal with that.
Yeah.
And then the scarring, if there are dark spots, it's post-inflammatory hyperpigmentation.
Right.
If that's happening now after the lesions, what can they do?
For the discolorations of the skin, secondary to the main problem, first thing I always tell people is let's get rid of it. Let's find out what the cause of it so it doesn't keep recurring. Because it's the constant recurring of a condition that makes those hyperpigmentations occur more, right? And then it becomes a subtle thing. So otherwise,
After that, maybe
If-
you can try pigmentation
yeah,
treatment.
you can use pigmentation treatments, as simple as thing as salicylic acid or retinoic acid.
There's lots
You
of
can
topical
yeah,
options.
there are many,
Yeah.
many
In,
bleaches.
in fact, I put up
but
a...
don't use those until you stop the dermatitis.
Exactly. Or the folliculitis.
Right.
Okay, Ruth has a nice one about close contact grappling sports. So, judo, I imagine,
Right.
wrestling. Like
I've
that.
had some patients like that.
Okay, can other people's sweat affect another person's skin? Especially when in excess, or especially
Right.
with the material of rash guards, etc. So I think the answer is yes, but let's break it down.
Right. The answer is yes. First, from the sweat itself, there are certain medications that when you take it internally, it likes to go through the sweat pore. In other words, the sweat gland is one of the ways it gets excreted out of the body. If that's one of those drugs, if the drug that you're taking is one of those that gets excreted from there, like the antimalarials and things like that, you can actually, therefore, let's say you're allergic to quinine or chemicals related to that, you're allergic to it and you get exposed to the sweat that has that material, then you could get a reaction to it. Yes.
Well, I would imagine... Go ahead.
Regarding, however, the wearing of certain clothes, sweaty, the sweat, of course, makes things very moist and easy to penetrate,
sensitive.
and therefore and it also breaks down or is able to leach out the chemical that is an allergen and, let's say, the nice thing that you're wearing on top.
The rash guards and
Right.
workout clothes, right?
Right.
So
Most rash guards I see among my patients are colored.
Yeah.
Again, that's a dye. Again, whenever it's dyed, it's not 100% cotton. There's usually
mordant,
a mordant, like nickel or something like that. And metal is used to
Which is the top
attach,
allergen,
right?
nickel.
And it's an allergen.
and
you
nickel is
could-
activated by sweat. Interestingly
There you go.
enough. So, yeah. So when you're looking at sports, close contact with other people, let's say you've been good. Let's say that you're actually wearing stuff that's cotton, light colored, breathable, because you know you're allergic to rubbers, dyes, latex.
Right.
But you happen to be doing a close contact sport with someone
Mm-hmm.
who is using gloves that are black,
Right.
clothing that is stretchy. They
Right.
happen to shower in a beautiful, highly fragranced shampoo and soap.
That's right.
Yeah, you could get a reaction from that for sure. Because all of that is coming out, the sweat is making it a wonderful environment to break down all those chemicals
Right.
and make it actually more volatile, if you will. So if you're touching each other like this, you might start to see, right? And depending if you're wrestling or I don't know what, you might start to see some reactions on you if they happen to be your allergens too. It's a great question. Okay, nice. So we have another question about using, can I use virgin coconut oil as a feminine wash?
Yes, absolutely. It's a very, very good, clean cleansing agent. And especially,
We have about 10 minutes,
in
so
old people, for
making
instance,
sure we
with
get those
problems
questions
down
in.
there, in gentlemen who have problems down there, in people who have developed an allergy to the laundry soap down there, to the elastic, whatever, and they get this dry, rough, thick, and scaly, whatever. I tell them, you really
Or
need to
itching.
restore the barrier of your skin down there.
Yeah.
Let's not use any soap at all to
Yeah.
clean. Let's just get the coconut oil to clean that
Yeah.
area, you know, gets a little bit of water, and nowadays I even tell them, get bottled distilled water and not the water from the
So you
tap.
avoid
Because
chlorine.
many of the tap waters now have chlorine in them, and you just want to get rid of chemicals down there. And I tell you, within a couple of days, they're feeling so much better. Yes, it can be used as a cleanser.
Okay, I'm going to rush through some of these because we have about 5 minutes left. I misspoke earlier. Is bikini or Brazilian wax good for genital hygiene?
Not necessarily.
Yeah.
Some people who have it done is because they have very, very curly hair, and if they have very, very curly hair, they shave. They tend to therefore have that.
Ingrown hairs.
The ingrown hair may not know where to go anymore, and because it's curly, and so it may produce its own what we call pseudo folliculitis
The
of the
bumps.
hair, the little bumpy things that you develop down
Right.
there.
But it's, if I could just jump into, from a cosmetic like
Yes.
perspective, most of this is really an aesthetic choice.
Yes,
Right?
agreed.
Anytime you wax or whatever, that really is mostly aesthetic because the pubic hair actually is hygienic to keep there.
Mm-hmm.
There's a reason why we have hair down there. It's not a mistake. It's actually to help also keep out contaminants, right?
Mm-hmm.
So getting rid of it is actually not hygienic.
Mm-hmm.
Keeping it there is hygienic. But again, if you do have a personal preference for a certain aesthetic
right.
that you're after, and if you find that shaving causes problems, waxing is totally fine. There's another procedure that's really nice called sugaring that doesn't use heat and might be gentler, especially if you tend to be very inflammatory, hyperreactive. But again, look out for things like fragrance, all these things, because that's heat. Wax is applied with heat.
And I know some
Heat.
people who do laser.
That too.
If you
can
want to
also
really get
laser.
rid permanently of the hairs,
That's
you can
true.
have laser
But
hair removal.
going back to the sweat thing earlier, heat is the same thing. If you're going to be applying a lot of allergens and it's hot, you might really be asking for trouble. Noemi, are there hypoallergenic sanitary pads or liners? Cloth pads are good but inconvenient when you have to go out of the house or when traveling.
Very good question. I actually had a patient who sent me a sample of each of the things that she was using. And when I opened one very, very common one here, it smelled like the dickens. So said definitely that, not that. But there are some unscented products.
Yeah. It's
The
hard,
problem
though.
with some unscented products is that they still preserve it. And in order to get that white color,
Yeah,
they are
definitely.
usually bleached by some certain chemicals. So,
There are some in the United States more than here. So if you are comfortable buying on an e-commerce site in the United States, there are brands that will say non-bleached, non-chlorinated, and non-scented. Those will tend to look brown. They're not dirty. They're just not bleached to death, right? And that might be a better option. Some will say organic, and if they're certified organic, they will not have
That's right.
bleach or chlorine or anything. Otherwise, it's tough to look. You really have to look for something that isn't bleached, isn't chlorinated, and isn't scented.
I have some patients, I've said, let's go the old way. Buy some Curity diapers, 100% cotton, like your kids, like like we used to use for kids, and you wash them. You know.
There are period panties now that we actually like. My daughter and I like very much. There are several brands. I don't usually mention brands when she's around, so I'll wait when she's gone and I'll mention them. But there are period panties that tend to work quite well.
And they're
then
unscented and
they're unscented. The thing is, the colors tend to be dark and they tend to be stretchy. So depending on your allergies, what you have, you might be able to use some of those. Particularly one brand has lighter colors that aren't stretchy, so I can mention that. And then, I was going to say one more thing. Right, menstrual cups could be a real option because, again, if you get something that doesn't have dyes, if you get something that doesn't have latex or rubberized material, that might be a much better option, right?
Can I mention a company that I helped develop their hypoallergenic line of
clothing.
underwear?
Oh, I can mention that later.
You can mention it later.
I know she's talking about.
It's
They're
a
awesome.
very, very nice
I'll
company.
mention it. I'll mention it because I
okay.
know you gotta go.
Yes.
But wait. Okay. So yes, sort
Time
of
flies.
Time flies, and she
We're
has
having
patients
fun.
waiting, and she has research to work on. So,
Yes.
thank you very much. Remember, not all skin problems on the genitals are from sex.
That's right.
And yes, you can pass on other things through sex, through sweat, through just holding your baby, through close contact, through whatever. So look at where these things are, and obviously a patch test can be really helpful for you here.
Yeah, they should probably call all of this just partner dermatitis. Because
But you can get it from holding your baby.
Kanya nga. So partner with your child, partner with
No,
your
you don't
husband.
partner with your baby.
You don't? I do. I partner with my grandson and my granddaughter.
When you say
but-
partner, I think people readily assume it's romantic partner or
Oh,
sexual
okay.
partner.
Ah,
so.
okay.
I love you. Mwah. Thank
Love
you.
Thank you, everybody. Love you all.
Okay. Alrighty. So very quickly, the company that she was talking about for hypoallergenic underwear that is very, very good, certified organic. We did do a clinical study, I believe, with them. It's called Cottonique, Cotton, so cotton, IQUE, cottonique.com. Latex-free, dye-free, chlorine-free, bleach-free. Very, very well done. They have underwear, and they have, I think, casual, like leisure wear, and socks, which are so hard to find. We had another question. About period panties. So my daughter and I have used kind of a bunch. There's several brands in the United States. One's called Thinks, the other is called Nix, and the other is called Luna Pads. Luna Pads tends to be the one that has lighter colors and less stretch, and actually tends to be more effective in our experience. And Luna Pads comes in period panties or reusable pads, which are really awesome. And then look at your laundry detergent. We carry one called Fawn and Launder, but again, because of COVID stock situations, if we don't have that in stock at the moment, use Superwash, and you can even dilute it further because you don't need a lot of it. Adding VCO to Superwash specifically, you can, or you can just use one or the other. And then butt acne, good combination of products to manage butt knee. If it really is butt knee, so make sure to cleanse the area either with id soap or superwash so we don't contribute to the acne or folliculitis really from comedogens or acnegens in other products. Then id toner, id gel would be the next thing. And then, interestingly enough, spritz or apply the antiperspirant to control the sweat even more. Should really, really help. And then our genital warts are contagious and can be passed on by your partner. Yes, it is a viral condition. So, but again, as you heard earlier, so many of these things can be so many different things, right? So what you might be seeing as genital warts could be Molluscum Contagiosum, could be HPV manifestations, could be many, many other things. So really, at the end of the day, don't be guessing, especially in the genital area. You want to make sure a professional, a dermatologist, gets a proper look at that. So there, in closing, yes, and please don't forget, conditions like eczema and psoriasis are not contagious. If you happen to have a bacterial infection or skin viral infection, even for a bug that is normally not an issue and lives happily on our skin, if you are in close contact with someone who is immunocompromised, they might get the infection. It's very interesting, right? Connubial or consort dermatitis, because maybe you're using something you're not allergic to, a fragrance or a wash or whatever, but your partner is allergic to it. Contact with you can cause a problem for them. So if you would like any more information or a teleconsultation with my mother or any doctor we work with, please drop us a PM. If you would like help with your patch test results, you can contact us and we can customize recommendations for you based on your patch test results and possible cross-reactants. You can shop all our products, including the virgin coconut oil and monolaurin, and most of our products contain that virgin coconut oil monolaurin, at vmvhypoallergenics.com in the US and globally, .ph in the Philippines, and we've got lots of specials going on right now in the United States. It's a re-everything, a free gift of re-everything every time you shop one. The moisture-rich starter regimen for a qualified purchase, and lots of really cool products at 50% off that are nearing their sell-by date and are awesome to use. And in the Philippines, we have, which I think is great for Valentine's, a free gift of a lip gloss or a lipstick when you shop one. And also in our boutiques, you can get one as a free gift. And at VSRC, VMV Skin Research Center and clinics, they're offering a phenomenal bundle, really, with 2 superwash large size bottles, plus a Know-It oil, plus the monolaurin pellets. So check that out. Drop us a PM. We can help make that happen for you. We will be back next week. We're thinking the live stream topic might be different types of irritations and of reactions, right? Irritant, allergic, urticaria. These are different things, acne or acneiform. But let us know in the comments if there's something else you'd like us to cover. And yeah, that's it. Please subscribe to our YouTube channel and like us on Facebook and follow us on Instagram. And I also am happy to chat with you on Instagram at Laura@VMV. Otherwise, perfect timing. Thank you so much for joining us today. And yeah, we'll see you next week. Bye-bye.